So what do we do now? Standardized sample collection protocols. Everything should be standardized. Right from patient sample item foundation, labeling, strict. Every label is matched to the individual. That where the site of collection, accessibility, patient comfort, contamination, the technique that we use, the angle, the depth in which the needle is inserted. It makes a difference. If it is right on top, you won't be able to get the blood. If it just below just enter the blood vessel, then you're taking a lot of force and hemolysis. If it's in the center, then free flow. Then where is the tip of the needle? And where is the opening? Is it up or down? Then have you pierced through the second layer and gone down? Is there hemolysis? Is there hematoma? So there's so many things that we should put systems into place. So everybody talks about, and everybody thinks quality control is only a QC in the lab. No. Quality of the specimen, controlling that specimen integrity is not lost, is quality control in pre-analytical phase. For how many people this is a bulb-on moment? Type BO. Everybody, we all knew QC as only QC. No. Quality control is controlling and ensuring quality all across pre-analytical phase. Only then we will get correct values. And we have to ensure that all the risks are mitigated. Every step, wherever there is a risk, if something is not happening properly, doctor is not giving instructions properly, go tell him, sir, this is the instruction you have to give. Don't wait till he gives wrong. Sir, these are the instructions, special instruction. Other random sample, no instruction. But these are the tests where special instructions are there. Call all of them for a meeting. Tell them what it is. Or put up in the system. Patient should be prepared. Is the patient prepared? Yes. Click. Yes. Putting systems into place to minimize this, there's a strategy. And that is a strategy which we have to learn. How the protocols to be put, what protocols to be put, so that there is minimized variability and errors. Then comprehensive training, 1 hour training, 2 hour training. You will only have an overview about, okay, this is how problems happen. This is how errors happen. But how do you go and ensure that it doesn't happen? For that, you need to have comprehensive training. Wherein, like say, for example, I'll tell you, you're putting barcode. Okay, you need to put the barcode of the patient. Now, what I will do, in my mind, putting barcode on the tube is what I have to be doing. One person will go and put the barcode straight. One person will put it angle. One person will wrap it around the tube. One person will put it on the cap. He's putting the barcode. But if he's done it like that, how are we going to scan the barcode? So in order to teach them, we don't have to just tell them, put the barcode. We need to teach them, you need to put the barcode straight. And the reason why you need to put the barcode straight is because only then we can scan it and we can get the number. Now, if you put it across like this, the scanner will not take. If you round it, the scanner will not take. If you put it on the tube on top, it will not take. Unless you tell them. When you do something like that, the work is not done, then they will stop doing it. How many of you all feel that we do not concentrate on telling them? We tell them you to do it like this, but we don't tell them, if you don't do it like this, we do it and you do a mistake, and the types of mistake that can happen, and make them aware of the different types of mistakes. They are more aware of not doing mistakes. I want all of you all to type out now. All of you all type yes. If we tell them that you if you we explain to them, if you do it like this, then the work which you're doing is going to be wrong. How many of you all feel they will start doing it correctly? How many of you all feel they will start doing it correctly? If you feel yes, we now need to change our system of teaching by not just telling them the right way of doing, we also have to tell them the wrong way. If we do not do it properly, then it is not correct. Absolutely. So we need to change the way in which we teach people, train people. Gone are the days we tell them do this, do this, do this. Now we have to tell them if you do this, it is correct. But how do you do it is also important. What are the mistakes you should not do when you're doing this? Concentrate on the mistakes. Then they will avoid doing this mistake. That is how errors will stop. And use automation technology. When you use automation, all the errors are mitigated. I mean, I won't say all the errors, most of it can be mitigated. Now, how many of you all till now have understood how you have to approach sample integrity? I know many of you all would have come thinking that I'm going to teach you all where to put the tourniquet, how to use a tube, what it is. No. That everywhere people are, yes, it is important. We will tell. But you all have to learn where things go wrong, what you have to do, when you have to do. For how many of you all today, it was a different, totally different angle in which you are looking at pre-analytical phase. Please type out me, if it was you. I don't want this to be one-side lecture. I want all of y'all to start interacting. If you really resonate with what I'm saying. Absolutely. That is what we have to learn. That is what we have to start tuning our brain to start thinking in this direction. All of us, we know. It's only channeling it in that direction. Now, tomorrow when you go back to work, start implementing. Please note down. Please, all of you all note down these points. Whatever I'm saying. Of course, the recording will be there. You can go back and see the recording, but note down these points. These are very important. And when you go back and you go teach them, you show them how they're doing. Stand over there, see how they're doing. And after that, when you think, okay, now they're good, you again have to surprisingly go and check again. Because when the cop is there on the road, we will be extra cautious. And if nobody is there, but what we have to inculcate into our staff, whether people are watching or not watching, integrity should always be there. Inculcate into them the importance of their job. Give them that respect. If they don't do, even if they're just collecting a sample, when we give them an importance that you're doing such a, and this is the most important work, please do it correctly. Everybody plays an important role, not only the person in the handling the equipment. I would give credit. The most important person in a lab is the sample collection person. Then start noting down. Document all the timings. Then see whether everything is happening at that particular way, in the particular time, and at the place where it is supposed to. And once we map and we see some gaps, then we go on improving the system. And then what happens? There will be continuous improvement. It is continuous. Some new person will come, somebody will do a mistake, and we catch it, and we do not reprimand, we don't shout at them. All of us are humans, we do mistakes. No, don't do this. Because of this patient, now the value became wrong. And now because the value became wrong, he was not given the right treatment, as a result of which the patient suffered. Give them the entire scenario. Next time, they will never, never, ever make a mistake. And that is how you empower them with the right knowledge of the consequences of not doing a good job. The other point, please make people aware of the consequences of not doing a good job, because it is harming patients, not helping patients. So, all the quality indicators, turnaround time, monitoring the time from sample collection to analysis, timely processing, ensuring no hemolysis, clotting. Even if you're taking a swab, whether they have put it on the slide properly, whether they have dried it properly, have they sprayed it properly, whether they've gone for FNAC, have they aspirated properly, have they aspirated the material properly, or there's no material over there which is aspirated. When they're taking a swab, have they collected the swab properly? All this matters. Then you evaluate, track, and then you see how many times one error is happening and where it is happening. And if you find that one particular time when one particular person is there, it's happening, then we know that that person needs to be trained. Then we intervene and there is scope for improvement. So, how do we have the best practices? Training, training, training. Training is not just awareness. We get into it. We dissect the whole thing. At every step, we tell people what they have to do, how they have to do. Like starting from the MRD. Give a slip. Why patient age should be captured properly. Tell them the reason why you can't make a mistake over there. Because if the age is different, the biological reference intervals are tailored to that age. Now, instead of putting 47, you put 77. All the ranges are going to be different. Tell them the importance of this age. Tell them the importance of sex. Male is different, female is different. Tell them the importance of a value of an email, the value of a phone number, because tomorrow, if we want to communicate, we need that. So give them a list and take it in writing that, yes, we have understood why these things are to be captured and why it is mandatory, it should be correct. So continuously, new people will keep coming, old people will go, new people will come. So every time you can't go on training. So if you put a system where I'll tell you what we do in our lab. I teach one person. He teaches his junior. His junior learns, does, and then he teaches his junior. And that junior done. Till then, my job is not done. Once that happens, this cycle continues. My junior teaches his junior, junior teaches that junior. And that continues. What used to be a training of the laboratory process used to take 3 years for some technician to understand. Then it came down to 2 years. Then it came down to only, now it's come to 4 months. That fast people are grasping because the systems have been refined and they're just able to get on and learn. So that is how continuous education, quality monitoring. We need to regularly, suddenly we should go. We should see how they are doing and see if any gaps are there. And they shouldn't be scared about it. And then all of us should sit. Okay, how do we handle this? Let us call all multidisciplinary approach, lab staff, teams, call them. Okay, now this is an issue. Now you all suggest how we can go about it. Get them to answer. They'll come up with wonderful ideas because they are at the ground level. Collaborative approach.